thyroid. I would say that the percentage is maybe like 80-20, 80% hyper, 20% hypo. Hypo, it's pretty obvious. You know, the person said, I've gained 100 pounds in a week. I'm constipated. My hair is real brittle. My skin is turning thick.
Seriously, 100 pounds in a week?
Yeah, probably no. They'll start gaining weight, but a lot of it is fluid. A lot of it is edema. Yeah, I mean that's 100 pounds a week. That's like that's one New Year's Eve party.
Yeah.
That's what happens when they get off their Synthroid, right? That's swelling.
Yeah, most of it's edema. Most of it is just fluid accumulation. But this is what you need to be aware of here, is because as the agents are, these anti-thyroid drugs are typically given to the patient, usually in combination with propranolol. Now, propranolol is a drug we give the patient to slow their heart rate down. It's a beta blocker. But we're also giving them propylthiouracil or methimazole. I would say most patients have PTU. Okay? But they both kind of do the same thing. Remember, they block the coupling. So the problem then also is how long do we stop it? Okay, notice it says we need to stop it for a few days. Most people stop it for about 3 days because it gets very dangerous if you stop it longer than that. But here's the problem with both of these two anti-thyroid drugs. After about 6 months, the patient's going to start developing a granulocytosis. So normally the 3 ways that you treat hyperthyroidism is surgery, drugs, and iodine. The drugs you can use for about 6 months, and then you have to go to option number 2, either the surgery or the iodine. Most physicians prefer the iodine. Okay? Can you think of any reason where you might want to do surgery on a patient who's hyperthyroid? Well, now if they have Graves' disease, you can see on the thyroid scan, the whole gland is involved. Give 8 millicuries of iodine, you take care of the problem. But if,
It's reoccurring.
reoccurring, okay. Usually if you see a nodule in there, that kind of, if you have a cold nodule or a hot nodule, some of those things turn out to be cancer. So that would be the best time to go in there and do surgery on that. But remember that the surgery is very risky. There's a very high probability of you losing your vocal cords and things like that. Okay, so these are the 2 important anti-thyroid drugs. And remember, we stop them because of the agranulocytosis, which means it affects what part of your body? Mr. Via, if you have agranulocytosis, what part of your body will be affected?
The name sounds familiar. I can't think of it.
Okay, A means absent. Granulocytes are white blood cells. Your bone marrow. Or your bone marrow. Okay, both of these drugs after about 6 months are going to affect the bone marrow, and so you have to stop them, and then we have to go to another option. Steroids and things like that. Okay, one of the things I wanted to also mention here, this competing anions, that's basically what we do with SSKI and things like that. But potassium perchlorate is one of these drugs they sell on the internet anytime there's a radiation emergency. Somebody gave me a package of all these potassium perchlorate pills for nuclear medicine technologists who are exposed to large quantities of radiation. Okay, the bad news is that this stuff only works if you ingest the radiation. Okay, so it doesn't work if you're just being exposed to the patient. I'll bring you some and you can have them with you and they will reassure you, okay? But if there's ever an accident like they had over in Japan, you can sell those things for probably $100 a pill. They only probably cost about 10 cents a pill. Okay,